Welcome to the deep dive. We take the sources you send us, dig in, and pull out the crucial insights, the surprising stuff, everything you need to get up to speed fast.
And today we're looking at something pretty fundamental.
Yeah, birth. You know, we often picture it as this totally natural, smooth event. But what happens when things go wrong? When nature, well, hits a bump in the road, especially for these really large or, exotic animals.
It's fascinating, isn't it, how even for species that seem perfectly adapted, birth can suddenly become this huge, sometimes dangerous challenge. It really shows you the delicate balance involved.
Exactly. And you've provided some great research for us today, including a really detailed comparison piece. So our mission, our deep dives, is to unpack all the clinical jargon around dystocia, that's difficult or prolonged labor.
Right.
We want to pull out the most important takeaways and give you a solid grasp of how it happens and how it's managed in two really interesting groups. The camelids, so camels, llamas, alpacas, and the cervids, the deer family. Get ready, because there are some genuinely surprising facts here. It's a fascinating look into a critical issue.
Definitely.
So let's start with the basics. For anyone maybe not familiar with the term, what exactly is dystocia?
Okay, so at its core, dystocia just means difficult labor or labor that goes on too long. It's the point where some kind of help, some assistance, is needed to actually deliver the fetus successfully.
So it's not just slow, it's stuck, essentially. Needs intervention.
Precisely. Intervention becomes essential for, well, hopefully, a positive outcome for both mother and baby.
Got it. And what usually causes this? Are there sort of universal reasons why birth might become difficult?
Yeah, broadly speaking, there are. You can usually group the causes into two main buckets: maternal factors and fetal factors.
Okay.
So maternal factors are issues with the mother herself. Things like uterine inertia. That's when her contractions just aren't strong enough, or they stop altogether.
Ah.
Or maybe there are pelvic problems. Her pelvis is too narrow, maybe misshapen from an old injury. Even the cervix not opening properly, not dilating fully.
So the mother's body isn't quite cooperating with the process.
That's a good way to put it.
Yeah.
Then you have the fetal factors, problems related to the baby. Maybe it's in the wrong position, malposition or malpresentation, we call it.
Head down, feet first, that kind of thing.
Exactly. Or sometimes the fetus is just too big for the birth canal. And in rarer cases, you can have congenital abnormalities, birth defects that physically prevent a normal delivery.
Wow. So a lot has to go right for it to go smoothly.
It really does. It highlights how complex the whole process is.
And why does tackling dystocia matter so much beyond just that immediate crisis? Is this just a vet problem, or does it have wider implications?
Oh, it's much bigger than just a clinical curiosity.
Yeah.
Dealing with it effectively is absolutely vital for, the reproductive success of these animals. And crucially, for the welfare of both the mother, the dam, and the offspring. If you don't manage it, the consequences ripple outwards. It affects future breeding, survival rates. It's a big deal.
Dire consequences you mentioned earlier. What actually happens physiologically if it's not resolved quickly?
Well, the physical toll is immense. The mother's uterus can just get exhausted, uterine fatigue and contractions stop.
Okay.
The fetus is at huge risk of hypoxia, which is oxygen deprivation that can cause brain damage or death.
Oh, wow.
And for both of them, the risk of serious injury, like tears or fractures, and infection goes way up. Or, tragically, death for one or both. It really is a race against time. Every hour counts.
That really sets the stage. Okay, let's zoom in on one of our focus groups then, the camelids. Camels, llamas, alpacas. How common is dystocia here, and what's usually behind it?
Well, it's generally thought of as fairly rare, but the actual numbers can vary quite a bit. You see reports from as low as, say, 0.4% up to maybe 9% in some herds.
That's quite a range.
It is. But here's the really striking thing, especially for dromedary camels. Dystocia is overwhelmingly caused by fetal factors. We're talking nearly 80% of cases.
80%. Due to the fetus, that seems really high compared to the maternal side?
It is, yeah. Maternal issues are much less common in dromedaries.
So what is it about the camel fetus specifically that causes so many problems?
It mostly boils down to their unique anatomy. You've got these incredibly long necks and long limbs on the fetus.
Ah, I can picture that.
Yeah, and that's the main reason. Malposture, the fetus, being in the wrong position, is the #1 cause. Easily over half of all dystocia cases.
Just all tangled up, I imagine, like trying to fold a deck chair in a phone box.
Huh, that's not a bad analogy. Yeah, the common problems are things like one or both front legs being bent back at the wrist, at the carpus, or even at the shoulder,
Okay.
or the head, and that long neck being turned off to the side instead of pointing towards the exit. And then, much rarer, but you do see these severe congenital issues, sometimes clinically called fetal monsters, which sounds dramatic, but it reflects how badly formed they can be.
Like what?
Things like schistosoma reflexus, where the spine is severely curved backwards and the internal organs are exposed, or porosomus alumbus, a fetus basically missing its lower back. Hydrocephalus 2, water on the brain. Really serious developmental problems.
Wow, okay. So mostly fetal posture issues, sometimes these really severe abnormalities. What about the less common maternal causes in camels? You said they're about 20%.
Yeah, around that.
Right.
Uterus twisting on itself, that's a significant one, especially in camels that have had babies before. Interestingly, it seems less common in dromedaries than in, say, llamas or alpacas. Failure of the cervix to dilate properly is another relatively common maternal cause. And then you have things like a young camel having her first baby. Her pelvis might just be too small, pelvic immaturity. Or maybe a previous pelvic fracture has narrowed the birth canal. And uterine inertia, weak contractions can happen too, though less often the primary cause than fetal issues.
So given all these possibilities, how do you actually spot a camel in trouble? What are the signs?
Recognizing it early is key, of course, though that can be tricky if they're not closely watched. Generally, you'd suspect dystocia if that first stage of labor, the restlessness and preparation, goes on for more than 6 hours.
Okay.
Or if the second stage, the actual pushing, lasts more than 2 hours without the fetus appearing or progressing.
And what would you see?
Obvious signs of distress, like colic symptoms, abdominal pain, straining really hard, maybe making unusual noises, vocalizing, getting up and down a lot, sometimes bloody discharge from the vagina, or just looking really depressed and exhausted.
Right. And how do you confirm it?
Diagnosis usually starts with a vaginal exam. You check how dilated the cervix is, and you try to feel the fetus, figure out its presentation, position, and posture. Is it coming forwards or backwards? Is it right side up? Are the limbs and head where they should be?
Okay.
Ultrasound can be helpful too, checking if the fetus is still alive, looking for obvious abnormalities. And, of course, the animal's history helps, age, previous births, things like that.
Right. So you figured out it's dystocia. Now, the hard part may be actually treating it in an animal that big and potentially stressed. How do you manage that?
Yeah, that's a huge challenge. Restraint is critical. You're dealing with a large, potentially uncooperative animal.
Yeah.
Often you need to get them into what's called sternal recumbency, basically sitting down, resting on their chest. And sometimes sedation, maybe with something like xylazine, is needed just to handle them safely for everyone involved.
Makes sense. So once they're manageable, what are the treatment options?
Well, if you catch it reasonably early, say, within 12 hours or so, the first thing to try is usually manual correction. The technical term is mutation.
Mutation?
Yeah, it basically means changing the fetus's position. It involves repulsion, carefully pushing the fetus back a little bit deeper into the uterus to give yourself some room to work.
Oh, okay.
And then you try to manually correct the problem, straighten out a bent leg, bring the head and neck around into the right alignment, basically guide it into the correct position for delivery.
So like internal rearrangement, what if that doesn't work? Or if, sadly, the fetus has already died?
If manual correction fails or isn't possible, or if the fetus is confirmed dead, then a phytotomy might be an option.
Phytotomy, cutting the fetus.
Yes, exactly. It involves surgically cutting the fetus into smaller pieces inside the uterus so you can remove them one by one. It takes a lot of skill, and you need enough space in there to actually do it safely.
Wow, that sounds intense.
It is. And often, really, the safest and most effective option, especially if manual attempts fail, or if the cervix isn't opening, or if the case is presented late, maybe more than 12 hours in, is a cesarean section, a C-section.
Okay.
It's also pretty much the go-to treatment if you have uterine torsion.
So C-section is often the best bet for a live calf and mother in difficult cases.
Often, yes. It bypasses the blockage, essentially.
But what happens afterwards, even if the delivery is successful? What are the risks or complications following dystocia in camels?
The aftermath can still be really serious. As I mentioned, if intervention is delayed, the survival rates plummet. Fetal mortality can be incredibly high, up to 88% in some studies, and the mother's mortality can be up to 18%.
That's stark.
It really is. And even if they both survive the birth, the mother is at high risk for complications. Uterine infections are common metritis, which is inflammation, or pyometra, which is pus collecting in the uterus. Retained placenta is another issue where the afterbirth doesn't come out. And uterine prolapse, where the whole uterus basically turns inside out and comes out of the body.
Oh, my goodness.
Yeah, and all of these things can lead to permanent infertility or even kill the camel later on.
Right.
So surviving the birth is just the first hurdle.
Right. It's not just about getting the baby out. It's about the mother's long-term health, too. Okay, let's shift gears now to our other group, the cervids, the deer family. This feels quite different, especially thinking about wild populations versus farmed deer. What's the picture for dystocia in deer?
You're right, it is different. And getting information on wild deer is tough. Dystocia probably happens, but it's very rarely seen. Usually the outcome in the wild is grim. Often the doe and the fawn both die before anyone even finds them.
So it's likely underreported just because of the circumstances.
Exactly. But we have much better data from farmed or captive deer. There, the incidence rates are reported between about 0.5% and nearly 6%. And in those managed herds, dystocia is actually a major cause of death around the time of birth perinatal mortality.
Okay, so definitely a significant issue in farmed settings. What are the main maternal causes driving dystocia in deer?
Uterine inertia is a big one. Those weak contractions again. And interestingly, in deer, this can often be triggered by stress.
Stress. Like what kind?
Human disturbance being handled or moved near birthing time, even just really bad weather, can apparently stress them enough to interfere with labor contractions.
Wow, that's sensitive.
It seems so. Another key maternal factor is fetopelvic disproportion. Basically, the fawn is too big for the doe's pelvis,
Okay.
and the doe's body condition plays into this. If she's overly fat, the fawn might be oversized. But if she's in poor condition, really thin, she might just not have the physical strength to push effectively, even if the fawn isn't particularly large.
A kind of double-edged sword with nutrition there.
Exactly. And like camels, uterine torsion can happen in deer too.
So stress is a big factor on the maternal side. What about fetal causes in deer?
Maldisposition, wrong presentation, position, or posture is common here too. Deer usually have just one offspring at a time. They're monodicous.
Right, just one fawn, typically.
Yeah. And that single fetus tends to be relatively large compared to the mother's size, which just makes it more likely to get positioned incorrectly during birth.
Makes sense.
Fetal oversize is also a major concern, especially in farm deer. There's a specific issue where sometimes smaller breeds or subspecies of hinds are bred with much larger sires from a different subspecies.
Oh, like trying to get bigger offspring quickly.
Exactly. For example, breeding a smaller red deer hind with a much larger wapiti bull. That mismatch can easily lead to a fawn that's simply too big for the mother to deliver naturally.
That really highlights the human management factor in farmed situations.
Okay, so how do you spot dystocia in deer? And does diagnosis differ much from camels or between wild and farmed?
In farmed or captive deer, you'd suspect it if a doe has been actively pushing second-stage labor for more than, say, 3 hours without making progress.
Longer window than camels, then? A bit longer, yes. You might see signs like restlessness, obvious distress, or maybe just part of the fawn appearing abnormally, like only the head or just one leg sticking out.
Okay.
In the wild, as we said, it's usually a grim discovery, finding the doe dead with a partially delivered fawn. That's often the only diagnosis. In farm settings, though, the diagnostic approach is similar to camels. A careful physical exam, maybe ultrasound, looking at the history.
The contrast for wild deer is really stark. So for farm deer where you can intervene, what are the treatment options? Knowing intervention in the wild is basically impossible.
Right, wild intervention is off the table. For farm deer, the first step is always careful handling to minimize stress, given what we know about stress impacting labor.
Good point.
Manual correction, like in camels, is possible, often under sedation. But, and this is a really critical difference, deer pelvics and uterine tissues are incredibly fragile.
Fragile. How so?
Much more delicate than in, say, cattle or even camels. If you use too much force trying to reposition the fawn manually, it's very easy to cause serious damage, like pelvic fractures in the doe or tearing the uterus.
Wow. Okay, that completely changes the approach, doesn't it? You can't just apply the same force you might use elsewhere.
Absolutely not. You have to be extremely careful, very gentle. And because of this high risk of injury with manual manipulation...
You go to C-section sooner.
Exactly. That's the key takeaway for deer. A cesarean section is often recommended much earlier in the process. It's seen less as a last resort and more as a primary, safer option to avoid causing potentially fatal injuries to the doe through manipulation.
That's a huge practical difference based on anatomy, so surgery becomes a more upfront consideration.
Definitely. And after delivery, whether manual or C-section, the doe needs supportive care antibiotics, maybe oxytocin to help the uterus contract. And if the fawn survives, It might need help breathing, warming up, and definitely supplemental feeding, as the doe might not mother it immediately, especially after a stressful event.
Makes sense. And what about the outcomes? Are the complications similar to camels?
The mortality risk is very high for deer experiencing dystocia, for both the doe and the fawn. There was one study on farmed white-tailed deer that was pretty sobering. It found that 91% of dystocia cases ended with the death of the doe or the fawn, or both.
91%. That's incredibly high.
It is. Postpartum complications like uterine infections and uterine prolapse can happen, similar to other species, but perhaps they're less documented in deer compared to, say, domestic livestock. The immediate mortality seems to be the biggest documented issue.
Okay, so let's pull this all together. We've looked closely at camels and deer. What are the big similarities you see when comparing dystocia in these two groups?
Well, despite all the differences, the fundamental causes are similar, right? It always comes back to that mix of maternal factors, problems with the mother, and fetal factors, problems with the offspring. The ways we diagnose it are also pretty similar, relying on observation, timing, physical exams, ultrasound, and the basic treatment toolkit has overlap. Manual corrections, C-section, supportive medications.
But the differences are where it gets really fascinating, highlighting their unique biology.
Absolutely. That's where you see the specific challenges, like the sheer dominance of fetal causes in camels, driven by that unique anatomy, the super long limbs and neck, and those rare but dramatic fetal monsters.
Right, the 80% fetal factor.
Yeah, whereas in deer, it feels like a more balanced split between maternal and fetal causes, but with those unique triggers like stress from disturbance and the specific issue of fetal oversize from crossing different subspecies in farms.
And the fragility.
And the fragility, that's probably the most crucial difference in management. The deer's delicate tissues mean you lean towards C-section much earlier, treating manual correction with extreme caution. That's a major divergence from how you might approach a camel or a cow.
Yeah, that really stands out.
And of course, the massive difference in simply being able to intervene between wild and farmed deer. That's less about biology and more about logistics and ethics, but it's a huge factor in outcomes.
Definitely. So, knowing all these risks and differences, what are the key prevention strategies that might apply across both camels and deer, at least in managed settings?
Prevention really comes down to good husbandry and management. Number one is probably nutritional management, avoiding dams getting too fat, which leads to big babies, but also avoiding them being too thin and weak for labor.
Finding that balance.
Exactly. Then there's breeding management, being smart about selecting breeding pairs, trying to avoid known incompatibilities, like the small hind-large sire issue in deer, or maybe avoiding breeding very young females.
Okay.
And finally, just close observation during that late pregnancy period. Monitoring animals closely allows for early detection if problems start, and early intervention nearly always gives a better outcome.
That makes sense. This whole comparison has been really insightful, seeing the universal problem of dystocia play out so differently. What's one thing that really struck you in pulling this together?
For me, it's just seeing that incredible, intricate biological dance that has to happen perfectly for a normal birth.
Yeah.
And then seeing how, despite completely different bodies and lifestyles, camels and deer share some core vulnerabilities. But it also hammers home how crucial careful observation and tailored intervention are. Knowing about that deer fragility, for instance, fundamentally changes how you'd approach that situation. It's applied biology at its most critical.
Yeah, absolutely. We've seen how dystocia, these difficult births, aren't just abstract veterinary problems. They're complex knots of anatomy, environment, stress, and management, playing out with unique twists in camels and deer. And the knowledge gained from careful research and observation is just vital for the welfare of these amazing animals, whether they're in our care or out in the wild.
Definitely. And when you dive deep like this, looking at the specific risks, a camel's long neck, a deer's fragile pelvis, it really underscores the incredible precision, but also the potential weak points in reproduction across all species, including ourselves, maybe. It makes you wonder, doesn't it? What other biological processes that seem simple on the surface actually hide these kinds of intricate species-specific challenges underneath?